9:28 right now on your Tuesday morning, and if you're like us, you are doing everything you can to avoid the flu. It's bad this year.
It is really scary. And Ohio Health Urgent Care Director Glenn Williams is here this morning with 5 easy tips you can use to try to keep your home flu-free. Because this has been the worst I feel like it's been in a while. It's all we talk about.
Yeah.
Because people are just getting sick left and right.
And every morning we're getting updated numbers about, children that have died, and
Right.
adults, and states that are, on practically lockdown.
Right.
It's bad.
What can we do?
It's been a bad year. We know that. Excuse me. The first thing really primarily with preventing flu and preventing that spread is getting the flu shot. We know time and time again that the flu shot is going to help prevent the flu. And if you do get the flu, let's say, because we know that this year the flu vaccine isn't really hitting that strain that great. We all know that. But if you do get the flu, even if you've had the flu shot, you're going to have less symptoms. It's going to be less complications and less duration. So getting that flu shot is essential. It's still time to get the flu shot. So, if you haven't gotten it, still go out and get it.
Well, I was going to ask you still have people coming in now, maybe more so than at the start of the season, because they're afraid. They're realizing
Absolutely.
you've got to get one. Yeah.
It is. And, to remember, the flu shot covers 4 different strains of flu. And so right now we're seeing predominantly one strain, the H3N2 strain, and there's potentially other strains that could still come out. So even though we're seeing a lot of, that one strain now, if you get the flu shot now, you'll still have protection of that in about 2 weeks. It takes about 2 weeks to get that protection. And you'll have protection against those other strains, moving forward.
When are we going to start seeing this kind of die down a little bit and people not getting as sick and as, being able to spread it to as many people?
Right. It's hard to predict sometimes with the flu. It's a very tricky virus, but we are seeing some indications in the last couple weeks that we're seeing some decline. If you look at the numbers for Ohio and across the nation, there's about an average of a little bit of a peak and a little bit of a decline over the last couple weeks. So we're hopeful that that will indicate that it's going to reduce. Again, other strains could pop up, so you just never know.
Right. So this is the big question we all have. How do we keep ourselves protected, especially at home? If you have a little one at home, we know they love to carry things around.
Right.
How does parents not get sick? How did the other kids in the house not get
Do you
sick?
quarantine them? I mean,
Yeah.
how does that even work?
Certainly one of the things you can do is quarantine to a certain part of the house. Everybody likes to move around the house, go out and sit in the family room, go into different rooms and kitchens and stuff. But, if you have the flu, kind of quarantine to one room is helpful, because then you're kind of only trying to disinfect that one room, keeping that virus on those surfaces in just that one room. Certainly can help.
Right. And
So
so should like mom or dad be wearing a mask to go in that room? Because I feel like you're still breathing that same
Certainly that's
air.
helpful. I mean, wearing mask, if the child wants to wear a mask or the person that's sick wants to wear a mask, that also helps, because if we remember, the flu is a respiratory droplet virus. So it'll go out into those respiratory droplets when we cough, sneeze, or even talk. So if you're within 6 feet of somebody talking, with that virus, you could potentially get it exposed to you. So wearing a mask like we have here, where you can get these at the drugstore, a little mask you can wear, can help reduce that, transmission in the house.
And we
So
need to be disinfecting, I'm sure.
No, absolutely. I was going to say a lot of the stuff that you brought today, this is what a lot of people are obviously dealing with because they're sick. I mean, the Clorox disinfectant wipes, I feel like we use this constantly at work.
We do.
I wipe
the
down
time.
the traffic center,
Our phone,
yeah,
the telephones,
everything I can.
everything.
Right, and the virus can live on surfaces for up to 24 hours. So we know that wiping
gross.
down all those surfaces as much as we can, is very beneficial. Even soapy water can help, remove those viruses. But there's Clorox, there's some bleaches, bleach materials. But making sure you're wiping down the surfaces, and then in addition, cleaning ourselves. So washing hands frequently. Soap and water, 20 seconds is very essential to keeping that virus from, getting on us, not touching face, mouth, all those kind of things can help.
And this might sound silly, but a lot of times when you think of flu, you immediately think of throwing up and being nauseated. I mean, what are the symptoms, the big things that people are noticing kind of from the get-go this year?
That's a great
with this
question.
strain?
And certainly the hallmark of flu is high fever, body aches, feel like you got hit by a train.
The worst.
Right. And you can be coughing, you can sneeze, have some runny nose, sore throat. You can have some vomiting, diarrhea, although that's more typical in the younger population, not as typical in adults.
Okay.
So a lot of times when you have vomiting, diarrhea, it could be a different virus, but it can be flu. But hallmark would be high fever, body aches, feel like you got hit by a truck.
How are you treating it?
So old-time remedies. So for those that aren't at high risk, so those that aren't under 5, aren't pregnant, don't have chronic diseases, those that aren't over 65, can really stay at home, fluids, rest, give it time. Quarantine,
so
right?
hard, yeah.
Write
Wait it
stuff down.
out.
Yeah.
Those that are at higher risk, and certainly those that are worried if their symptoms are worsening, definitely see your provider, your doctor, your physician assistant, et cetera, because they may have some medication like Tamiflu that would be beneficial to reduce those complications.
Okay. And this might sound like a dumb question, but I know we have to keep up on the laundry. So
Right.
do you change bed sheets every 24 hours, or how often do you have to do it? I mean, if someone in there is sick.
Or you don't even bother with the quarantined room. You
Right.
just keep
Yeah.
it all in there.
You can wait and see. Certainly if that person's feeling better and they're out and about, then taking a laundry basket, so you're not taking all those clothes and stuff in your hands, but
Right.
towels, sheets. Certainly when they're feeling better, certainly is an option to do.
What do you think has been, just with your profession, been the hardest thing kind of watching folks come in to see, talk about how sick they are this season? I mean, what bothers you the most about it?
The challenge, there's two challenges. I think one is, there's not a lot to prescribe. There's not a lot to do outside of those home remedies for people that have the flu. And it's very challenging. It's very uncomfortable to have the flu, and they look really sick typically. So that's hard. And then there's folks that just don't want to get a flu shot. And we just know that the flu shot can really help reduce that transmission. And when you're reducing the flu in you and I, we're helping reduce that transmission to those very young. And we're seeing a lot of pediatric deaths this year.
It's very
and those
sad,
very
yes.
old and those very, sick that can have complications from the flu.
All right. Well, good things to know. That's for sure.
Seriously.
Thank you. And everyone feel better out there, because it is. I just feel that it's one of the worst things
I
to
feel
deal with.
fortunate that I have not.
Right.
I mean, knock
you
on
better
wood.
knock on this basket.
I don't even
sister.
know. My goodness. But I feel fortunate I've had it, but so many folks have, and
Yeah.
it's not good.
Well, thank you so much. We posted the tips for you on our website. Just head to myfox28columbus.com and click on Good Day Columbus. We'll be right back.